Kidney infection versus kidney stones. How do you tell the difference? If you've got pain in your lower back and you're not sure if you've got kidney stones or kidney infection, it can be difficult to work out what's going on. Because both of these conditions affect your kidneys, the location of the pain can be the same. The treatments that you need are different for both of these conditions, so that's why it's important to spot the differences early on. Both of these can become dangerous, so in this video, I'll cover the important red flag symptoms that you need to know. Rachel is a patient of mine and she's 34. She came into the urgent care department in the evening. She said, "Doctor, I've got severe right-sided lower back pain. I don't remember hurting myself and I have no idea why it started." She looks quite pale and sweaty and in a lot of discomfort. At this point, I was still confused about whether it's muscular, whether it's stones or infection. But then Rachel said, "And doctor, I've noticed that I'm shivering today. I've never felt this hot and sweaty and it's coming in waves." Well, that is an important clue and we medically call it rigors. The pain pattern. Kidney stones. A stone typically causes severe pain. People walk around, they can't sit still, and often they describe it like childbirth. They usually keep changing positions every few seconds because they can't find any position that makes them comfortable. It can start in your lower back area and then move to the front or move up and down from that region. Some people also experience it going towards the groin. The pain that's moving around is usually happening because the stone is traveling down your ureter. So that's one of the tubes that allows the urine out of your body towards the bladder. Some people also notice they get nausea and vomiting alongside the pain. I have had patients who came in with a bright red sample of urine and a constant feeling of needing to pass urine. The clue is a stone doesn't generally cause a fever. It's more common to get a fever with kidney infections. A kidney infection can feel like a deep, constant ache in your lower back, usually on one side. The pain doesn't usually move and travel around like a kidney stone pain does. Other symptoms you might notice are fevers, flu-like symptoms, feeling exhausted. It's also very common with a kidney infection to get urinary symptoms. Burning when you pee, going to the bathroom more than usual, more cloudy or strong smelling urine. The quick 60-second test. If you notice that the pain is coming in waves, making you restless or hard to sit down, if the pain is moving up and down or especially towards your groin, if you notice no fever symptoms like a temperature or chills, or your urine has turned pink, these symptoms are more common generally if you have kidney stones. I just want to be clear that if a kidney stone is stuck and an infection develops around that area, you can get infection type symptoms. So it's not completely black and white. Generally, going to the bathroom more than usual, burning when you pee, is more common with a urine infection or a kidney infection than with stones. But again, there is some symptom overlap. When to go to the emergency department. If you have a fever and you notice a temperature above 38 and you're having shivering and shaking episodes, if you're vomiting and you can't keep down fluids, if your pain is severe and you can't control it with normal pain relief, if you're starting to feel faint or lightheaded or dizzy and it's hard to walk around, if you're pregnant, if you have a known condition like diabetes or anything that makes you immunocompromised, if you're not able to pass urine when you go to the bathroom and it all feels stuck, these are emergency signs you need to go to the hospital immediately. This is so we can do any investigations or tests that you might need. In Rachel's case, she was diagnosed with a kidney infection. This is after we tested her urine, we looked at her observations, things like her temperature and her blood pressure, and then we did a set of blood tests. This all shows high levels of infection markers. Rachel was able to pass urine, she was having burning when she was peeing, and she was going more than usual, and altogether she was diagnosed with a kidney infection. We also call that. As I've explained, kidney infections can become serious, so you need to go to the emergency department if you have any of those symptoms. If you haven't got the fever yet and you're feeling generally well, the only thing you've noticed is you've got some mild urinary symptoms, going more than usual, burning when you pee, not able to hold it in. In this situation, it's important to take pain relief, drink plenty of fluids, and keep an eye on your symptoms. If they clear up and go away and you're feeling back to normal, then you don't need to go to the emergency department. Another one of my patients was called Tom. He was 59. He noticed he had sudden left-sided lower back pain. He had no fever when he attended the emergency department when I saw him. He was pacing around, he couldn't sit down, he couldn't settle, he was feeling severe nausea, and he noticed the pain was radiating towards his testicles. This is a classic story of a kidney stone. He was able to pass urine, so it wasn't fully obstructed. it becomes more urgent to go to the emergency department if you're struggling to pass urine, which could mean that a stone is stopping the flow of urine, if you can't keep down fluids and you're vomiting the whole time, if you started to get fevers, shivering, and shaking, which could mean you're developing an infection on top. How are they both treated? Kidney stones are usually treated with strong pain relief, whereas kidney infections, like what Rachel had, needed IV antibiotics and fluids. With kidney stones, we also usually prescribe anti-inflammatory medications to help ease the pain. If you have a small kidney stone, it could pass through on its own. If you have a larger kidney stone, you might need more medical intervention. This will depend on the size of the stone, the location of the stone, and whether you've developed any infection-type symptoms. Depending on what these results show, you might need a treatment to break up the stone, and there's a range of different treatments available. Thank you for watching today's video, and I hope you found it useful. If you write any comments down below, I'll get back to you, and it also helps my channel to keep on growing if you click the word subscribe.